This is Malamulo Adventist Hospital in Malawi, Africa. It's a 275-bed Christian mission hospital that was founded in 1902, which makes it one of the largest and oldest in this area. Our students are rotating through all the departments here to get a taste of the different areas of in-hospital medicine. Every morning, the students start by walking to morning worship and then beginning the rounds with the doctors.
I was doing the surgery department, so I was in OR. For today, we were able to have 3 C-sections. So all the babies came out super healthy. I was able to see the procedure and how they were able to make an incision and pull that apart little by little, saw small steps of how a baby was able to come out into this world. The last baby, she came out, but she wasn't crying. So they asked me to give her a sternal rub, kind of stimulate her so she can cry. And she was very blue, so I had to give her oxygen. And then in the end, we were able to have her color back, and she was crying, and she was very cute. So it was a wholesome moment to have. Ever since I was a little girl, I was always interested in surgery. It's kind of making me want to go into surgery. I'm just not sure particularly where, but based on what happened today, I feel like I can see things more clear, and I feel better about maybe my future decision.
Today we worked in the outpatient department of the Malamulo Adventist Hospital. It can be difficult at times, as we've seen today, but Dr. Chubako, who was helping us, has a good handle on what needs to be done and what medications get to prescribe. It forces you to think outside of the box and not just rely on the most available medicine. So you have to think, okay, what else could I provide for this patient? What are my other options that I could prescribe to help this patient?
Even as one of the bigger hospitals in this region, they're definitely not without their challenges still. During this morning's meeting with all the hospital doctors, the head doctor on call referred to their equipment shortages as a state of emergency. He said that certain departments were running out of sutures and having to take some from other departments. Because of resource shortages and supply chain issues, the doctors here are extra prepared to make the best out of every situation for the patients.
In the clinic here, I noticed that if for some reason they're lacking resources or they're limited in resources, they know how to make the situation better. With the US, we have more resources than what they have over here. And I honestly am so impressed. I have so much respect for them.
Everyone here at this hospital is working hard to overcome resource, staffing, and equipment shortages. Malamulo Adventist Hospital is also the site of an accredited 5-year surgical training program. This is done through the Pan-African Academy of Christian Surgeons, as well as Malamulo College of Health Sciences that shares a campus with the hospital. According to PACS, 93% of sub-Saharan Africa does not have access to safe surgical care. Malamulo is currently undergoing a new renovations program. They completed this large dental and surgical facility 2 years ago. This building here is the brand new surgical and dental center. It was also built with funding from America and a few other international sources. Even though the actual construction has been complete for quite a while, the brand new building still isn't in use, and that's because of electricity. Due to issues with electrical grid stability, it has yet to open its doors. Through the renovation program, they're working on getting solar for this facility so it doesn't have to depend on the grid, but that project hasn't been completed yet. Overall, it's because of the doctors and the staff at this hospital that they have become an excellent center of medicine and teaching for over 100 years.